And thank you. Yes, when he appeared on Mentalk, and he has been on Mentalk several times, and he has always been a hit because he's such a wealth of knowledge, and a gentleman who, you know, I really respect and admire. Just to give you a little bit of information on him, not all, director of the University of Western School of Nursing. He's a qualified registered nurse. He has a doctorate in public health, and he's also a motivational speaker. You know, he does a lot of speaking all over, and throughout the Caribbean and in Trinidad and Tobago. And that's why I grabbed him quickly to come on Mentalk. Well, when he came on Mentalk the first time, it wasn't through me, but since then I've been asking him to come back. And he's very down to earth, and you know, he says it like it is, and that's one of the things that I admire about him. So let me stop talking now and introduce our special guest tonight. He has a nice name. Well, one of his names. His name is Oscar Noel Ocho. Dr. Oscar Noel Ocho. Dr. Ocho, please welcome to our Kingdom Study, and I'm handing it over to you right now.
Thank you so very kindly, Professor. It truly is a delight and a real privilege for me to share on this platform and to engage the participants really in discussing, to my mind, a very important issue, because whether we like it or not, the realities of life will confront each one of us, in spite of the fact that we are children of God and we want to live right and we want to do right. Understanding that we are fearfully and wonderfully made, but in spite of the fact that we are fearfully and wonderfully made, sin has really, in a way, caused a lot of changes for a lot of us, and it has really affected God's original intention for man, because we were not born to die, we were born to live. We were born to be ever youthful. And I would imagine that's the reason why in the New Jerusalem, we'll have the tree of life, which will be for the healing of the nations. So how are we going to now deal with a reality that is going to affect all of us? And I hope that I would try to be as simple as is possible in examining the issues. You can feel free to stop me during the presentation to ask your questions. If it's coming up later, I'll tell you, or because I really want it to be as engaging as is possible. So I will sort of set the framework. But as I say, you can feel free to stop me. And I've entitled the presentation, Enjoying Life Through Andropause and Menopause. Okay? So let's start with the woman, because I would imagine we would have by far more women on the platform than we would have men. So before we even begin to understand the concept of menopause, we first have to appreciate another concept, which we call the climacteric. Now, for all of you as women, and again, because this section or these sessions are rooted in a theological foundation with a social reach, we need to recognize that we are fearfully and wonderfully made. And women have two hormones that they will contend with every month from the period of puberty right up to when they are diagnosed or when they recognize that they are in menopause. And every month when I say we, females, produce estrogen and the progesterone. Now, estrogen has a very important function, and you would understand why there are certain physiological changes that will take place as you go through menopause. Estrogen is stimulated by what we call the follicle stimulating hormone, the production in your ovaries. It's stimulated by the follicle stimulating hormone in your brain. And what that does, it helps in the growth and growth and development of your egg. And what happens is that every month you have your right side and your left side ovaries, which will produce the egg. And while that egg is growing and developing, that estrogen will have a very important function as it relates to allowing for the lining of your uterus to begin to become engorged with blood. And I usually use the example of having the first sheet on your bed. So what that does is that it's preparing your womb for an egg. Now, about day 12, the estrogen level will begin to fall, and the other hormone, your progesterone level, will begin to rise. And of course, this in and of itself will have a significant impact, not only on the lining of your uterus, because it is going to cause the more blood vessels to become engorged in the uterine lining, but it's also going to have other effects. Your breast will begin to become tender. Your vaginal secretions will become more fluidy, and you will feel tizzy. This is the period of time when you want to experience coitus, because you could feel as though you're going out of your head, because this egg is now finally being matured. And at about day 14, there is ovulation. And with that ovulation, the egg is released from your ovary, then it's sucked in by the ends of your fallopian tube, and it goes down. It starts moving through the fallopian tube, but in the process of moving through, the sperm which is deposited in your vagina moves up to enter into a marital arrangement with the egg. And then, as long as there is fertilization, it then finally moves into your uterus, where it becomes lodged in your uterine cavity. And because of the level of engorgement of blood, then it allows for the growth and development of the egg. Now, so that will happen every month. But as you go through your climacteric, what is going to happen is that you would find that there is, as it were, a slowing down of the production of your estrogen or your progesterone. And as a result of that, you would have a number of symptoms that may be associated with menopause. So it's important to recognize that your climacteric is a period that you would experience where the body's normal physiological functions will begin to change. And that usually starts from about the age 40 to 45. And as a rule of thumb, women who start their menses later usually go into menopause earlier. But when we speak about menopause, menopause is defined as the biological end of a woman's reproductive ability. In fact, when you are into menopause, you are not able to conceive anymore, because the period of the progesterone development, especially, which is to help to sustain the development of the fetus in the uterine cavity, will also have been diminished. And that is why it's defined as, you are defined as being in menopause after 1 year after the last menstrual period. And this is a very important point that I want our ladies on this platform to understand. Because if you don't, you would appreciate why some of you will end up with what we call menopausal babies. Now, there are causes of menopause. One is from a biological point of view, where there is the reduction, as it were, in your estrogen and the progesterone production. But on the other hand, you can go into menopause almost, well, not almost, you could go into immediate menopause through surgical operations. So take, for example, a woman may have fibroids, okay? And she may say, I have to go and remove my fibroids, which is called myomectomy. But what happens is sometimes when the doctor gets in, what they realize is that there is already some damage, and what they may do, instead of just removing your fibroids, they may remove your ovaries, which we call oophorectomy. Now, and then they may also do what we call total abdominal hysterectomy, where they will remove your uterus, your fallopian tubes, and your ovaries. As long as your ovaries are removed, you will go into automatic menopause, because it means that the body is no longer able to produce the estrogen and the progesterone. So it's very important, if you know you are going for a surgical operation to remove your fibroids, be clear in your conversation with your doctor that he is only going to do myomectomy and not oophorectomy or total abdominal hysterectomy. So when a woman goes into menopause, what then are some of the signs and symptoms? Of course, because there is a lowering of your estrogen production, what is likely to happen, there will be irregular menstrual cycles. Now, women are all different. There are some women who have normal cycles where they may have 3 to 5 day bleeds, and they could put their pot on the fire and know that every 28 days they will have their menstrual flow. If that is normal for you, that's normal. There are some individuals, based on their hormonal challenges, they may have irregular cycles. That is not an indication that you are going to enter climacteric or menopause if you are young. But from the time you begin to experience this, as you cross the threshold, you know that the normal physiological changes are taking place. So that's one. The other is the hot flushes. So some women will experience 1 minute heat, the next minute cold. You ask your husband to open the window because you're hot like a chula. Then the next minute you say, boy, close this. You feel as though you're having ache. And sometimes the men don't understand that you are not playing games, but you are just experiencing abnormal physiological response to the climacteric. Now, again, you will have things like vaginal dryness because your fluid is not being produced as readily. And we'll talk some more about that. And because of that vaginal dryness, you may find that intercourse will become painful. And as a result of that, you now have an increased risk of vaginal infections. Some women also experience a continuum. For some, they experience decreased libido. For some, this is the time they want everything. And for a lot of women, you have weight gain and dry, wrinkled skin. So it's important in understanding what the physiological processes are, to understand that, for example, if your menstrual cycle becomes irregular, then of course it's important, if you are still sexually active, continue to use contraceptives. And a lot of the contraceptives that are available, especially those that have both the estrogen and the progesterone, they have lower levels, and a lot of them can be recommended for women to go straight through into menopause, because they are becoming more sensitive to the needs of the woman. So you have to ensure that you continue to use your contraceptives. If you don't want to use the combined hormonal therapy, then of course the condoms are available. And it's also very important to keep tampons at hand. And it's important that you do this because you can never tell, as your cycles become irregular, you can never tell when you will ovulate. And it could be that you will ovulate at a time when you feel so hot and horny. And understand that while your egg could live for 1 to 3 days, the sperm could live for 1 to 5 days. So you are looking not only at the day of coitus, but before and after. So in case of vaginal dryness, again, because the lubrication is not there, it's important that here the man has to churn you up like ice cream, because he has to make sure that you are ready, so that when he enters, he can have a very important and satisfying experience. So to do that, don't use oil, not because they call it saltfish, you're going to put cooking oil. You have to use, Professor, you need to use a non-oil-based lubricant, right? Why non-oil-based? Because you do not want friction, to encourage high levels of friction. So again, it helps to keep at least the vagina in a nice, moist environment. You now have to extend foreplay. You can no longer behave as though you were 25, when you could just run in, jump on, jump off, and you feel good and you say hallelujah. Now you really have to take time. But the challenge you have is, as the women are experiencing the climacteric, as you churn her up, the man may also have challenges, because by the time you are ready, his kite is now ironed. So you need to negotiate. So the frequency at which you now have to enjoy that sexual experience will require a lot of negotiation. So you talk about, all right, weekend. All right, don't pressure me. I will prepare myself. Weekend, we will have a good time, okay? For painful intercourse, it's the same thing. Because of the dryness, can you have no feeling for sex? Yes, you can have no feeling for sex. For some people, because remember, understand understand, sex is not just a biological thing. Sex is a psychological experience as well. And for men especially, you have to understand that this psychological frame of mind is very critical, as well as for women. So the same thing you do is use your lubricant, extend your foreplay. For where you have decrease in libido, and for some people, they may have no feeling for sex because the manly breath not smelling good. You find the penis looking too kind of unfriendly. You're tired of that because you had enough of that, and you say, I want to serve my God because I ain't able with this wood anymore. Let me serve my Jesus, Or you may find that not because he's challenged. Some men want you to have them pack it in because they still want to feel as though they're in a safe zone and a safe space. And some women say, look, if you know you're leaving sour to take my bonus pain, don't drop me, barotaria. So you have those kinds of challenges where it becomes very frustrating. So that negotiation, it's about being innovative. How are we going to ensure that we could still satisfy each other? Now, the challenge for some people is that some men may want the women to become acrobats, all kinds of positions, and the poor arthritic changes that you have to contend with. So how can you be responsible enough and supportive enough and not make unnecessary kind of demands, And so it's important to pay special attention to your hygiene. For hot flushes, it's important that you drink plenty fluids. You reduce things like caffeine and chocolates and cheese. From your diet, you want to eat cool foods. Keep a rag handy because sometimes you could just be drooling with sweat. And I say to women, use a lot of cotton clothes. So even your underwear, these bingo bags that are nylon, you want to use cotton underwears because again, you have to understand. And when we come to increased risk of infection, you want air to pass through your clothing. So all these satin clothes that you love to wear because you love how it does look shiny, those things you have to give up to allow for your own comfort. For the risk of vaginal secretions, you want to drink a lot of fluids. You want to ensure that you pay special attention to your vaginal area, your pubic area, because we understand with the moisture is a fertile environment for the growth and the production of microorganisms. So you want to look at reducing that. And that's one of the reasons why you wear cotton rather than nylon underwears as well. Because your estrogen level or your estrogen helps in, as it were, the normal distribution of your fat. You would find that for a lot of women, as they go through their climacteric, they begin to experience weight gain. And for most women, what is most distressing and upsetting is the fact that you begin to see the depositing of the fat tissue in your abdominal region. And you do know you want to ensure that you could have a clear definition of your waist versus your hip, okay? So as a result of the reduced estrogen level, now those fat deposits are being laid down. And so you find that with that weight gain, it can be quite distressing for some women. So you want to reduce the amount of fried foods in your diet, increase your fiber, increase your vitamin E with your green dark green leafy vegetables because they help to mop up the cholesterol. And you also want to see if you could get into an exercise routine. You would find that because of this, you may start having dry, wrinkled skin as well. So use an oil-based cream, not a water-based cream. For a lot of women, because of the hot flushes and the psychological trauma that they begin to experience, some of them wonder, am I good enough for my husband? Would he love me? Because when you look at the data, our national statistics show that the rate of divorce increases after 25 years of marriage or after the age of 50, smack into the period of your climacteric into menopause. So the psychological trauma associated with that, the stressors, some women try to every 2 weeks go to hairdresser because they believe that they would keep their mates attracted to them. So you really want to, you know, as you deal with all of these psychological issues, which may be disturbing your sleep, you want to ensure that your stress tolerance level is up to its maximum. You take control of, you know, what is happening in your life. You know, have a bath before going to bed. And you could use music therapy or aromatherapy, you know, change the lighting in your room that may contribute to your being able to sleep. Now, some of the complications of menopause, women, I want you to recognize that your risk for heart diseases increase after menopause. Why? Because the estrogen, which is responsible for distributing your fat, is no longer able to do so. So again, you want to ensure that you look at your fiber and so on. Another important complication of menopause is what we call osteoporosis. So you would find that for some women, they start protruding forward and their spine begins to take on a kind of curvature, which we call the Dower's hump syndrome. So you would find that older women now run an increased risk for hip fractures because there is the reabsorption of the calcium from your bones to ensure that your calcium level in your blood is maintained. So you want to ensure that when people tell you about taking calcium supplements, most of it, you spend money, but most of it will be excreted because the body doesn't store the excess, the body excretes it. So you want to be able to look for foods that have some level of calcium, okay, like your dashi, and you also want to increase your omega-3 fatty acids. I want to encourage women as well, before menopause, you should ensure that you continue to have your pap smears done because you want to ensure that you can be able to maintain a healthy life and check yourself. Critically for you women, especially during your menstrual cycles, you need to do your breast self-examinations because you need to know your body better than anybody else because cervical and breast cancer increase post-menopause. And there are some issues that you have to contend with. So a woman at the age of 35, she should, if she has no family history, she should start at least age 35. A rule of thumb is you do your pap smear once every year for 3 years. If nothing shows up, you want to be able to do your pap smear then every 5 years. Now, the standards change, the routines change. Women, same thing. If you have a family history though, you want to start a little earlier, whether you have breast or cervical cancer, because we are seeing more and more younger persons are coming down with cancer. So your breast self-examination, do your mammograms, as well as your pap smears. So some of the psychosocial issues could now be your relationship can become routine. This is a period of time where some men are looking for a second spring. So the extramarital affairs, this is the time when the emptiness syndrome, because you would not have invested in your relationship. What is there to talk to? There is no sort of communication. And some people, now that the children have gone, I'm no longer enduring the relationship because I never enjoyed it in the first place. But while the women experience and undergo menopause, men also experience what we call andropause. But the difference between men and women is while, and I'll talk about hormonal replacement in a bit. I just want to touch on the men so I could get the opportunity to answer some questions that you may have. Is that while the women have, in most instances, a very shortened period of the climacteric that will lead into menopause, men do not have that experience. For a lot of men, this is a period in your life when your testosterone level begins to fall. But the men's testosterone level fall much more slowly than women's level. So therefore, you would find that for some men, except those with erectile dysfunction problems, you go through andropause over a more extended period of time. Now, the reality that we have to face is that sometimes there are lots of different schools of thought as to how regular a man should have his scrotal sac ejaculated. And for some individuals, they say that, you know, men need ejaculation at least 20 times for the month, okay? And one of the principles that we have to understand within the context of andropause, looking at a statement from the book, What Every Adult Needs to Know About Impotence, is that sex is man's second strongest instinct, an instinct that is second only to his survival instinct. This means that if a man's life is not immediately in peril, the next thing he would automatically think of is sex. So it's important that we understand what then are the challenges of andropause. Some men, because this is a period of time where they are going through, and we need to understand that there's a period what we call the midlife crisis, which is different to andropause. But as the men go through the midlife crisis, is a period of time where he begins to think about his own mortality. He begins to think about, am I ready for retirement? Have I prepared myself well enough? He begins to think about his usefulness and his purposefulness. So men, as they go through this period of the midlife crisis onto the period of andropause, they psychologically, they may experience anxiety. For some of them, they experience depressive episodes. And of course, this Gorgon that they were so used to standing up as the Rock of Gibraltar, they begin to question the fear of impotence. Sometimes could affect them to the point that they become so demoralized and they feel emasculated. Sometimes some men may overreact because they feel that they can't face themselves and the reality of what is happening to them at the particular point in time. Now, the St. Louis Adam, which is the androgen deficiency in aging male, they look at some specific symptoms that one would want to evaluate. Things like decrease in sex drive. If you understand then that sex is a man's normal instinct, and of course, as he's going through this psychologically, if he feels that his sense of manhood will be threatened, and you know, some of you women, the men may be going through their challenges, and you know this is the time when you could hit them under the belt. So he is trying to do a work, and he is working hard, poor fella. He is trying his best to see how he could sustain. And one question, you finish yet, could affect his entire sexual experience. His kite could immediately IO. And what does that do to his ability to rebound? To be able to get back to some sense of normalcy. For some men, they have lack of energy. You know, they're accustomed playing sport and they say, no, but not today. I ain't able with that. Decreased strength and endurance. That's why men know when to start your family. Don't wait until you start to go over the hill to prove to the other fellas that you can still do it. By the time the boy's ready to play, you're not able. You're not able. And you're frustrated because the wife is still looking like a fruit. You know, the decreased enjoyment in life. Some men become so grumpy and irritable and itchy, they fly off the handle. Now, another challenge that men may face is that they may have erections, but they may not be able to sustain their erections, okay? And, you know, this will lead to things like decrease in sex drive. But for some men, they try to overcompensate by trying to prove that they could still do it. So they try to increase. So they go and they get all these aphrodisiacs, and they don't recognize that the physiological issues and challenges of aging are upon them. So you find that for some men, they want to use the Viagra, not recognizing that Viagra really wasn't produced pharmaceutically in the first instance as a drug to enhance sex. But they realized the side effect was an increase in libido. So you find that you take the Viagra and not understanding the impact of that on your heart. So you tell yourself, I'm going to take it anyway. You want to die happy and smiling. If you die on duty, you want to go to your grave with a smile on your face, and you may end up writing in pain because of the pressure that you put on your heart. So it's something for us men to understand. At 50, you are not 15. At 60, you are not 16. So you have to batten your crease. If you get it once a month, say hallelujah, praise God, and make it look good. Allow it to still have some memories And there will come a time when the kite will IO. It will no longer be able to stand up. You could invest in memories, powder it, play with it. Talk about the times you used to have. Invest in your memories. Say, boy and girl, look how we used to be. Look at us now. And she no longer stoops in. She may just hold it and say, boy, let me play with it. And you feel like $1 million. It's still as flaccid as Chup Chup, but you still get somebody to put some value to it. Because we as men have to realize we may not be able all the days of our life to stand with our gun at erection and fire. There will come a time when the gun will hang like a slinging shot. And all you have to do is wear proper jockey to at least keep it in place so it wouldn't reach down to the ground. You understand? So you have to ensure that your relationship, doesn't get into routine. You have to realize that your wife is aging with you. So when you want her to play Jack Spanier and helicopter and goatee look back, and all them, how the lady could manage with that? Because you now want to feel as though I'm still alive. Oh God, give me that girl, give me. It can work. So you have to be able to ensure that there comes a time. You all are laughing, but as Professor will tell you, I prefer to be down to earth because people are not here to hear all this scientific jargon. We're dealing with life. And I want husbands and wives to realize that even if you can't stand at attention, okay, and everybody else calling you Mr., not having an erection, you're still a man. You're a whole man. You're a full man. It's just that you can't park the way you used to, okay? So you want to ensure that you continue to acknowledge the vow that you made. So men, it's important that you remain in good physical condition. Women, some of you killing the men, and you say, I like to see him eat. Oh God, when you see him eat my food, so I feel like $1 million. And you're giving him all kind of fried thing, all kind of set of rice and provision and macaroni pie, and say, here, the man, I just cut it down like a mountain. And what you're doing, you're damaging the man's heart. You're increasing cholesterol level. And then the next thing, poor man, the blood vessels damaged. He could no longer have enough blood to engorge the penis. So that thing that you used to enjoy, you could no longer enjoy it. And you're killing him. And he realized that you're sending him to your grave because you are the one who will outlive him anyway. And he's thinking about the house of bill. Imagine a next man is going to come and inherit that. And you're glad you thought, oh God, girl, he does eat, I like to see him. You're killing him. Try to give the man vegetables. Try to give the man balanced meal. Make sure that he eats his salad because you still want him around. You wanted him to look fresh as a rose because you want him there for you, and he want to be there. He want to die and leave you. It's important. So, maintain a close family relationship. Don't let anybody know that you're going through problems. You can make it talk, people. Some of you as men, you become so close, you don't want to talk. You're afraid all the time. Sometimes the wife, she's dressing up. You find she looking good. And tonight, you know how she does behave. She ain't telling you anything. And she preparing for a piece of work in the bedroom tonight. Poor fella, you so scared that your kite would not be able to fly. You, man, you try to do everything. And sometimes you run in bed before her and you start to snore. Or you find yourself doing things doing things, hoping that when you reach inside, she will be sleeping and you know, you ease onto the bed. Cool, cool, cool. You understand? Let me tell you, men talk. Because the more you talk about your fears and your concerns, is the more opportunity you would have for her to give you the support and the care, and she will still love you. She didn't just love your penis, she loved all of you, but the penis made her a little warm sometimes, where she could call for police and she want the police to come. And she said, kill me, and you don't share what they did. Of course, so you have to understand this. So you have to, as men, to get into your feelings. Get into your feelings. Don't close up. Don't close up. You know what you are going through. Don't try to mask it, because too many of us fake it. You know, women could fake having a climax. They could make all kind of before you. What you could do? You can't fake nothing. So talk about your fears. Talk about your concerns. Ask her for understanding. Tell her about this is a time when you want affection. This is a time when you want acceptance. This is a time when you want understanding. This is a time when you say, baby, oh God, love me, love me, love me. Just tell me you love me, because you know the boy. You know, I have nobody else. You have, so make him validate him, because he's feeling as though his world is being ended. You know, don't go into sulkiness and depression, because that's why a lot of men go into depression. And even some Christian men, they find themselves, you know, wanting to go for extramarital relationships and so on. You don't want that. And men, we have to stop laughing at other men. Stop joking at other men. Don't, you know, let men know that they are not alone, that you understand what they're going through. Encourage them, encourage them, encourage them. So whilst I'm saying fortify Ezekiel, listen to him, compliment him, you know, don't make demands that put undue pressure on him, and try not to ignore him. And again, I want to end by reminding you, you know, about really finding ways to relieve stress. Eat your nutritious meals, low fat, high fiber, sleep, exercise, find a group to talk to, you know, and if you know you have chronic non-communicable diseases, men, take care of yourself. You know, if you have high blood pressure, the long-term side effect of the pressure tablets is impotence. You know, if you have diabetes, the long-term pathological effect is impotence. So take care of yourself, you know, and really recognize that God is still a good God, and you can still enjoy life. And if in case Boykin dead, you could and you're diabetic, you could always check the Diabetes Association. You can have a surgical pump implanted. So it's just like a blood pressure kit. They could surgically put it there. When you're ready, you pump it up. You pump it up. When you finish, you out it down. Nobody has to know that you are being supported by a mechanical device. And remember, keep God central to your relationships. Professor?
Thank you so much, so much, Dr. Ocho. What we're going to do, folks, now is if you have any questions, ask your questions now, please. Raise your hand so that we can acknowledge you, and ask. And when we acknowledge you, you ask a question, and also Ocho will answer. Okay, we don't want everybody just unmuting themselves and asking questions. So please raise your hand.
Dr.
Yes.
Richards,
Yeah.
there are questions already in the chat. Can I do that and then we can take hands?
Okay, go ahead. Go ahead.
All right. So one of the questions, Dr. Ocho, can you have no feelings for sex?
Yes, as I indicated, both for men and women. Women, as they go through their climacteric intermenopause, they can have decreased libido to no libido. Men, because of their fears, to protect themselves, they sometimes may decide, I am putting myself through that stress. Yeah.
All right. Another question. How safe is hormone replacement?
Okay. Yes. Now, and again, in my previous job, I was director of the population program unit of the Ministry of Health. So we were responsible for all the contraceptives that would come on the market in the public health sector. What the pharmaceutical agencies have been doing is that they have been reducing the level of estrogen and progesterone, especially in the combined pills. However, they still will tell you if you have a family history of breast or cervical cancer, you want to be able to at least speak with your gynecologist, but the level of the hormones in your combined hormonal replacement therapy is as such that it can allow you to go straight into menopause. It's fairly safe, but it may be dependent on your family history as well.
Okay. Other question. What if your spouse or the man does not want to have vegetable or vegetables, I should say?
Well, if he doesn't want to eat it, let him drink it. Make smoothie. Give him green juice.
Good. That's a good thought there. What food should we eat for?
And you see, let me tell you, you see, a lot of times we as men don't realize what is best for us. So when you're introducing this, a lot of times they don't see themselves at risk. So you must not come over as though you are his mother, or you are the one trying to tell him that he has to do this. You have to get him to the point in behavior change to recognize in doing this, it is for his good and his best interest.
Man, that's right. That is correct. What foods can be eaten for calcium? I think you may have mentioned
Right.
to the person they're asking again.
Yes, so I know for one is dasheen. For some of your cereals, you can also get calcium. In fact, if you check, there are lots of vegetables as well from which you will get your calcium. So it's very, very important. And I want to see, you cannot wait until you reach menopause to increase the calcium. One of the best ways, as Dr. Terry Ali would have said years ago, as an orthopedist who is also a sports therapist, he says, start an exercise program early in life.
Okay, thank you very much. Now we can take the raised hands. These are all the questions in the chat, Dr.
Right.
Ocho.
So I had seen Hyacinth had her hand up.
Hyacinth. Hyacinth?
I'm here. Good night, everyone. Special good
Go ahead.
Joe. I read in the newspaper some time ago of a very young lady. Her age was about 29 years, and it was said that she was into menopause. Is that possible?
Yes, it is possible. In fact, it is clear that people who are into sports go into earlier menopause. But remember, for all of us, menopause, as I indicated, it's 1 year after your last menstruation. So that person may have had some level of hormonal challenge that may not have been picked up, that may have led to that, or is it that she may have had some kind of biological challenge and she had a surgical intervention where she had her ovaries removed. So, but yes, it is not common, but yes, some women can go into menopause that early.
Anyone else? Just raise your hand, please, and we'll acknowledge you. And don't be shy. As you see, Dr. Ocho wasn't shy, so you don't be shy too either.
Thank you, Dr. Ocho. And on the other hand now, I have quite a few relatives and they are in their 60s and still having a period. How does this really work?
All right. Now, again, for some women, while the norm is that at this time, they should have experienced menopause. It could be something with your genetic makeup. However, you want to be sure, that it is a menstrual flow and not an experience of pathology. But yes, some women could go outside of the norm and have their menses, and as long as it's coming monthly, normally, nothing is wrong with you. You are fine. So you don't have to go to the doctor to find out if something is wrong with you.
Mm-hmm.
Thanks again.
You're very welcome.
Any more questions, folks?
I guess, I don't know if I give them some shock therapy.
Question.
Okay, who is that? Who is this?
Kimani?
Kimani?
There's a question in the chat.
Okay, question in the chat.
Okay, Pastor Nicole.
Yeah, I'm
question in
sorry.
the chat
Yeah,
from
I'm
Kimani.
sorry. My apologies. My mother has never experienced menopause, and so are her girl children. It's like a generation thing. Should we be concerned of anything like illness?
And I would say no, because you could see it's family history, it's normal. So don't try to create a problem when none exists. No, I would say no, because you could trace it to your family history.
Okay.
Sherry-Ann Huggins.
Good evening. Dr. Ocho, I know at least 2 persons who were in menopause for a number of years, and then their period would have come back for a couple of months as if they were younger. What would be the cause of that, and is that something to be concerned about?
I would say a big fat yes to be concerned, because if you would have experienced menopause, understand what menopause is. Menopause is diagnosed as no menstrual flow for 1 year. So if your last menstrual flow was in October 2020 and you had no menstrual flow up to November 2021, you are into menopause. If a menstrual flow returns very often, that is an indication of some level of pathology. We encourage women, go get the pap smear. Now it may not be pathology, but for all things being equal, that may be an indication that something is going on and the woman needs to get
They
her
need
smear.
to get a pap smear, yes, and
The
to go
pap
for.
smear is important
I
at
think
this
I'll go monk
particular
too,
time
again.
because we shouldn't be experiencing
No.
that postmenopause.
Okay, Dr. Ocho, you mentioned something in passing earlier on when you were talking about the men, about needing sex 20 times a month. You want to elaborate on that?
Well, I don't know if I want to elaborate. I'm just saying this is this is a recommendation by some of the researchers as it relates to the health of your prostate. Again, but these are schools of thought, okay? And again, it all depends on the individual and the quality of your relationship. Somebody asked a question, is heavy bleeding before menopause normal? And sometimes it's yes, where some women have very, 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 not only heavy, but painful. Some of it may be related to how your uterus is structurally. So if you have like a retroverted uterus, for some, if you have fibroids, that also increases the level of heavy bleeding that you would have. So some of it could be related to the functional defects, as well as some things that are internal to your body. So the answer is yes.
Okay. Another question, Dr. Ocho. Is it possible that during menopause, women have an increased drive for sex rather than decreased? And I'm thinking psychologically because of the fact that they know now that they can't get pregnant. So it may free them up psychologically. Is that possible?
Yes, exactly. And that's why I said they could go across a continuum. So while some women may say,
To ask your question, why do some women get panic attacks and all those things during menopause?
Okay, folks, those who ask a question, could you just wait, please, to be acknowledged? Put up your hand and then we will acknowledge you.
yeah.
Yes, sir.
Also, as I indicated, some women, I have heard of one woman says she could take the size of 5 penis in one, you know, while she was going through her menopause, because she was so hyped sexually because she said, I don't have to worry about children or nobody, this is my time now. So again, it all depends on the person's psychological state of being. Somebody has in the chat, is it normal for bleeding to take up to 2 weeks? And again, for some women, it may be normal. And again, that may also be an indication of something that may be going on. Either sometimes the person has fibroids, the person may have a hormonal deficiency. So for some people, when they're very stressed, it also affects them. So that there are a number of factors. I would say if it is normal for you to bleed 2 weeks, that's fine. But if you find that you are bleeding for 2 weeks at different intervals, then I would strongly recommend check your gynecologist.
There's a next question, Dr. Ocho, in the chat. Someone says, I was robbed of my sexual enjoyment because of my husband's drinking ability. Is there any way that I can help him in order to regain my enjoyment?
Well,
and also can constant thought help in eliminating the heavy flow of blood going through menopause?
Let me answer the first question. It's difficult because as I indicated at the beginning, sex is not just a biological, but it's a psychological experience. So if that person has had a drinking problem, so let's say now, praise God, the person would have had, would have overcome the drinking problem and maybe fine. I don't know. One has to consider whether there are emotional scars or physiological scars that have been created and which may be very difficult to repair, but it is not irreparable. I think a couple like this will need professional help and counseling to see if that can be able to help them. Constant thought, I don't know, for some people, I know they use the, is it constant as the, is it, and I'm trying, I don't know if I'm getting a senior moment, but I'm trying to remember if they're talking about the constant thought as a painkiller. Whether that is what they're talking about, and let me go back into the question. And if there's a difference with using painkillers to reduce the flow. For some women, it is encouraged to have sitz baths where you could sit over the warm water, which, as it were, helps in the movement of the clots, which will then help with the involution of the uterus. I see some hands, but I also see.
There's a question, is it normal to bleed because of pap smear? And is it normal to bleed because of a pap smear? And if you're a single woman, not sexually active, should you have a pap smear?
Okay.
And if
now,
so, how often?
Now, there's a difference with bleeding and spotting. Because remember, with the pap smear, what they are doing, they are scraping the zone, a particular part of your, at the beginning of your uterus, which, as it were, may expose you to some vascular irritation, so the woman may spot. If she bleeds, on the other hand, that is not normal. If you're single, no sexual activity, and do you need to have a pap smear? The reality is, while we do know that sexual early coitus and multiple partners increase your risk for cervical cancer, the fact that you still have a cervix, it is a good thing just to do some prophylactic management by getting yourself checked. Aisha?
Folks, yes, Aisha, his hand has been up for a little while. Aisha, are you there?
Okay, maybe Aisha. I think I saw Kerwin's hand up earlier as well. My good friend.
Kerwin is here? Kerwin
I saw
is
his
here?
hand up earlier.
Oh, okay. Folks, it's 9:28. Well, if we have no more questions, if Kerwin doesn't have a question.
There's a question in the chat. If your spouse have erectile problems and don't care to do anything to please his wife, what can be done to help the situation? Here, I guess all you have to do is pray and see if you get counseling. Be patient with him because he might be going through a cycle, that erectile dysfunction. And women, that's why I tell you, be understanding, be considerate. You know, don't tell him, look at you, your dick dead. Why you don't stop breathing one time and dead one time? You know, because you would be damaging him. So this requires a lot of patience and support, and sometimes spiritual and professional intervention.
Yeah.
So,
Okay,
are you
folks.
sure seem to be are you sure I'm seeing that you're unmuted? Do you want to ask your question now?
I guess not.
I guess not.
Well, if there are no more questions, Professor, I just want to say it was such a delight sharing with you and your group. I'm amazed at one point I saw 98 people and I was like, oh my goodness, I thought that was
you know, 98.1 FM. Okay, somebody
oh, yes,
something.
Aisha?
Can you use milk for calcium?
Can what?
Can you use milk for calcium?
Well, yes, but also don't forget the body does not store excess calcium. And as adults, we really don't need milk, you know, but we are just used to it. But yes, you will get some calcium from milk.
And if you're taking medication that stops your period?
If you're taking medication
that stops your period, would you go into early menopause?
No. Stopping your period could even with some of the progestin-based contraceptives. For some women, they do have amenorrhea. Amenorrhea, which is the absence of the period, is different to menopause. Menopause results from the body's inability to produce estrogen and progesterone that will cause the menstrual flow.
Okay, thank you, Dr.
All right, I saw Cohen stand up. Cohen, go ahead. Cohen, unmute. Okay, I'm not sure what is happening with Cohen. Yes, Cohen.
Oh, yeah, I to what you said earlier on that men should speak. I must say we are trying vigorously, but men are so afraid to share with each other. I mean, so afraid, and therefore we only speak of surface things, not deep at all. And there is a lot to say. And sometimes when you move the conversation forward, that is get it in a conversation. Men just walk away because for all different reasons. And Dr. Ocho highlighted some of them. You talking sex, some of them move away because they have the impression that they're either afraid the topic or they're experiencing what you are talking about. And I see that a lot in the warehouses that you go to, or the people who function in the operational side of receiving goods and that kind of thing. When the men gather, I am doing a little tracking now. So I meet different kind of people, and you find that it is a challenge for them to do so. On a lighter note, I want to also highlight that programs like have plenty less men. Educational program like this, there are more women on the thing, and that is what we are experiencing on many occasions. You know, so I want to say thank you for Dr. Ocho and Dr. Let me get it right. Oscar Noel
Listen, this formality is not important.
and Noel Richards. Let me get it right. Okay. Thank you for this program. I mean, it's quite educational. I sat and I listened tremendously. And I don't know what again men can do, or people like me, to get men to talk out, you know? So this is really helping me to move forward a little bit more to engage men. So thanks a lot. Thanks to both men.
Great, and thank you again, Kerwin. You know, the memories of the work we have done in gender will always remain near and dear to my heart. And you have done a great job. You have done what you were supposed to do, and it was a delight being part of the work you did.
All right, folks. Well, now we've come to the end of tonight. Could somebody stop the recording for me, please? We've come to the end of tonight, and I really want to say thank you so much, Dr. Ocho, for